Well, we've told you all about the cosmetic benefits of lipo. Today, America's favorite dermatologist, Dr. Tess Mauricio, says there are health benefits to lipo as well. She joins us again this morning. Always good to see you, Tess.
Great to see you.
So, health benefits to lipo. Who knew?
Yes. Well, you know, we're always concentrating whenever I'm here. We always talk about, oh, you're going to fit better in your jeans, you're going to look better. But actually, many of our patients report to us, we didn't really expect this, report to us that, you know, their blood pressure becomes better. Their doctors, their primary care doctors who've been telling them to lose weight, exercise, are actually happier because now, you know, their cholesterol is better controlled. And so it really could be, I mean, I'm not saying that if you have lipo, your cholesterol is going to be normal. You may still need your medications and you have to work with your doctor, but we do see it, and we're actually doing a small study in our clinic looking at blood work before and then after, a few months after lipo, because that's what our patients are telling us.
So it's basically if they get rid of some of that excess weight, they're able to move around better, and they just feel healthier overall.
Right, and I really think that it could be a kickstart to a healthier lifestyle because, as you know, when I go in there, I remove the fat, but there is maintenance involved, and it also gets people thinking about taking care of themselves. And then if for patients who are older, which we'll discuss later, mechanically they're just, you know, they're lighter, they can move better, they can do better workouts, they're not worried about injuring themselves as much. And so I think, you know, the weight goes down and they do start becoming healthier.
Yeah, and hopefully their diet changes a little bit, and like you said, they start maybe getting in the gym a little bit, start exercising.
And they feel better in gym clothes. A lot of my female patients say they feel embarrassed going into the gym, you know, with their lumps and bumps. And then when that's sculpted, and I personally, I was just telling you, I just had my lipo on my lump here. I've had saddlebags, this genetic thing, and now I feel so much better in, you know, the workout outfits, and they get encouraged to go in and they lose more weight and they get healthier.
Yeah, and the big thing for a lot of women, we were talking about this, is when they have babies, you know, post-pregnancy
weight gain, and you know, it really changes the body for a lot of women, and it affects their self-esteem. They don't feel sexy, and they cannot get rid of it for whatever reason. And when you're taking care of kids, you don't have time to exercise. And I know that we have a really nice before and after of a patient that
had a baby.
Just had it. She has 2 kids, and it's amazing. You can see a huge, this is 1 week after I did her liposculpture. Her tummy is now flat, and this is that type of fat that, you know, bulges, and now she was ecstatic. You can just imagine how happy she is. And the other thing about it is, in the past, you would see women like that in the before photo, and they would think that they would need a tummy tuck, where they would have to take and cut out the skin. And you can see in the after, that's 1 week, there's really no need, especially for women who are younger and have really great elastic skin.
Yeah, that is pretty dramatic. You know, and I'm sure she felt a lot better about herself. And who are we looking at here?
This is a patient who's in her 50s, very typical, tried to lose weight, cannot lose weight over the years. She thinks just her metabolism has changed. She swears she doesn't eat anything. She, you know, her body shape is just really, you know, bothers her. And this is 1 week after, Greg, and you can see we gave her hips back, her waist, and really a new lease on life, you know. I mean, she's so excited, and like I said, these are the type of patients who are now going to be going to the gym, working out, and they are going to be healthier.
Yeah, and this is Eberhard. This is one of your oldest patients.
One of my favorite patients. He's my oldest patient I've done lipo, and lipo is no longer just for young people who want little, you know, improvement here and there. And most of our patients now are over the age of 50. And obviously, patients have to be healthy enough to have the procedure. All of our patients over the age of 50 have medical clearance from their primary care doctor, but Eberhard is the first one who actually told me that his cholesterol, blood pressure was all normal.
Yeah, and we have some great specials. There you see the contact information to get a hold of Dr. Tess, 888-744-7004 or scripsderm.com.
Check out the website.
If we could take a look. just some incredible specials here.
Incredible specials for Mother's Day. We brought back our Dysport buy one get one area free because it was so popular. Restylane, and I administer all of these injectables personally, so I don't give them to a nurse. And then $500 of lipo, and you get Vela-shaped treatments free. You get Latisse, and you get $50 towards it. Amazing things. Just call the clinic, and we'll take care of you.
But you got to act now because all the specials expire on May 7th.
Before Mother's Day.
888-744-7004. Dr.
Great
Tess,
memory.
always a pleasure.
Pleasure.
All right.
Take care.
And of course,